Every time you come to Shriners Hospital for Children, you see progress. You see that hope come alive.
Shriners Hospital for Children Philadelphia is a destination healthcare provider for children in need of upper and lower extremity orthopedic care, spinal cord injury services, neuromuscular, sports, and acute orthopedic care.
We take care of kids from all over the country. In the last year, we took care of kids from 48 out of 50 states. And we take care of kids regardless of their ability to pay or not.
When Peter was born, he got an infection in the growth plate below his left knee.
My leg wasn't growing as it should.
We brought him down to Shriners. They assessed him and planned the first surgery. And in these 14 years, I guess he's had about 5 surgeries. And he will be perfect by the time we get him done.
I see a lot of children with arthrogryposis multiplex congenita, and these are children who are born with contractures of their upper and lower limbs. The joint doesn't move as it should.
Well, Joseph has arthrogryposis, and it affects his hips and his knees and his feet and his shoulders and his wrists and his elbows and his back and pretty much everything. When we adopted Joseph 2.5 years ago, we started right away trying to find doctors that could help him. Doctors would say, well, this is how he is. And then when we came here 1.5 years ago, we heard a different story. We had heard from other people about the Shriners here in Philadelphia, and we decided to come and get their opinion. And so we're glad we did, because they're able to work with him and really improving his ability to sit in a wheelchair and to do other things.
So most of what we do from the upper extremity standpoint at this hospital are pediatric nerve injuries. So about half of our practice is spinal cord injury, brachial plexus injury, peripheral nerve injuries. And these are injuries that for the most part are neglected in medicine.
We have our brace shop here. I have a great relationship with them. I can send a child back and say, gosh, this is not quite exactly how I need it, and they will work with me to make sure that it works well.
We really have an outstanding rehab staff. We're able to offer the full range of sports medicine care here. Patients go through a rigorous return to sports testing protocol before they go back to their sports to make sure that they're fully rehabbed and safe to return to play.
She was diagnosed with scoliosis when she was 9 months old. Opted to get a second opinion, and we fell in love with Shriners Hospital right away. I've never had a bad experience, ever. Between all the x-rays, all the visits, all the hospital stays. There were times she was here for 2 weeks. Never had anything bad to say, ever.
Yeah, so here at the Shriners Hospital for Children Philadelphia, I focus in on the spine program. This includes the full spectrum of spine care for the pediatric patient, including a vast array of non-operative care. We have an incredible bracing program, and then we go all the way to the very, very severe patient that requires many weeks in the hospital through halogravity traction, taking care of severe curvatures. We have the Eos Machine, which gives anywhere between 1/8 to 1/10 the radiation dose of a standard machine.
We're a 5-bed pediatric intensive care unit. We get all of our post-op spine fusions, post-op spine tetherings, lower extremity surgeries that get epidurals, and some upper extremity surgeries as well. We provide the highest level of care that we can here.
Our comprehensive care includes an outstanding rehabilitation program. In this program, patients have access to high-level, focused rehabilitation programs with cutting-edge technology such as the Zero-G and TheraStride, which can really help mobilize them in an efficient manner.
Just the approach, like they just, I don't know, and here we're like a person, there we're a number. You know, like we come in and they know who we are.
Our hospital is unique and different. So we do orthopedics, we do spinal cord injury. Some of our kids have upper extremity, lower extremity, and spinal deformities, and we treat the patient as a whole person.
With our spinal cord injury program, we have a lot of state-of-the-art technology that other places actually do not offer that can really help the children, especially with spinal cord injury, just recover and progress in their rehabilitation.
Timothy is 1, and he was actually diagnosed with a rare case of osteomyelitis. They came in and they said he may or may not be able to walk. The first thing that I thought in my mind was, what can I do to better his life in the future? So that's when I decided to research and see what was out there for him. So I actually Googled Shriners Hospital of Philadelphia, and I contacted the hospital, and they set me up. The opportunities that he's had here are extensive. He's done so much in a matter of 1 week with all of his therapists, and the community is awesome. I wouldn't want him anywhere else, and I wouldn't want to be with him anywhere else.
We believe in a three-legged stool. So we don't just care for patients, although that's the biggest leg on the stool. We provide clinical and basic science research, which is the second leg on the stool, and then we educate.
The research center does research on a very important priority for the Shriners hospitals nationwide. One of their priorities is to find ways to repair the injured nervous system of children who have suffered spinal cord injuries, brain injuries, or birth defects that are neurological.
We developed a simulation lab to help educate our staff and our students to promote safety for both the patients and for our staff members. It's part of our mission to further educate and to continue education on new devices, new techniques, and expert care in the type of patient population that we take care of.
We do have a lot of resident students who train here. I think we're able to be a great educational resource.
All the doctors are nice to me.
We know our kids are going to get the best possible care you can find in America.
They care about you.
We're really good at what we do, and I would allow any of my partners to operate on my own child, and that's the best compliment you can pay.
Love to the rescue is a perfect motto for Shriners Hospital, and I got here and I saw that this community was real, that it was really a home. And they know that my name is Naive, and they know that his name is Timothy.
I don't think there's any place else that that beats us in terms of the quality of care that we provide.
We have driven from Atlanta, we've driven from Toronto, we've driven from all over the eastern seaboard. We've flown from Phoenix, we've flown from Hong Kong just to come to Shriners Hospital for Children. Why? Because our child is worth it, and Shriners has the answer to his need, and they met that need completely.